Kia ora koutou, I'm Miranda.
Kia ora, ko Jacinta tōku ingoa.
And so we're both co-founders of Dignity, which is a social enterprise that works to deliver period equity. And that's basically why we're here today, is to discuss period inequity and women's health more generally and what more can be done in this space. So sadly, we know that in this country, lots of people who have periods miss out on being able to afford the products that they need or have access to the products that they need. And this has caused significant gender inequity because it obviously only affects one part of the population. And so this is a really significant issue that's been dealt with, and we want to dig deeper into that today. And so at Dignity, we basically support delivering period equity by through our Give One, Buy One, Give One model, where we support people having access to period products. We have a partnership with corporates, and through that we've been able to donate over 31,000 boxes of period products. And then we also have a donation side to our program as well, where individuals and corporate can give too. Sadly, COVID-19 has seen poverty worsen, and this has directly affected women quite significantly. So of the 10,000 people who have lost their jobs over the COVID period, 9,000 were women. And because of this, we are seeing an increase in need for period products. Yeah.
And we're really excited and proud that we've partnered with Global Women to facilitate this kōrero today. It's really important that we actually have these discussions on these topics. If you have any questions, please put them in the Q&A box in the bottom of your screens, and we will get to those at the end. To start with, we've got a few questions from our panel, and first off, we're going to get them to introduce themselves for a couple of minutes. So you've heard from both of us, the co-founders of Dignity. So we'll throw it over to Kōrero, a counsellor, teacher, educator on the front line with students and seeing people experiencing period poverty, to introduce yourself.
Kia ora, Miranda and Jacinta, and kia ora ngāho he whā from wherever you are. It's a real privilege to be part of this. I first had contact with Jacinta and Miranda when I think we're at uni, just starting to research this way back in the early 2000s when I was at a school. So I'm really delighted. I've been passionate about making sure that our young women have access to good health education, and we've been battling period poverty for a long time, so it's really nice to be part of this.
Kia ora. Yeah. We've also got Emma Parry here with us today, and it's really exciting because from the start, with the period products that we give away, we wanted them to be healthy and for women and for the planet. And so we deliberately chose Organic Initiative to be our partners. So we supply their full range of organic pads, tampons, and menstrual cups. And also we've got a partnership with our period underwear, and we've given away over 1,000 pairs of the period underwear. So part of our kaupapa is around choice, but actually really excited to hear from Emma today with her gynecology hat and around the health issues associated with periods and how this feeds into this whole discussion. So would love for you to introduce yourself.
Kia ora, everyone. Thank you, Miranda and Jacinta. Wonderful to be part of this. And I remember when I first came across you guys, I'm an old-time tweeter and Twitter follower, a bit of a lurker, and I saw your guys' tweets and I was like, oh wow, these guys are really cool. And I think I hit up on our CEO Helen Robinson. I said, right, you need to contact these girls, and it was wonderful to be able to link in what we're trying to do with organic sanitary products with what you guys are trying to do. And obviously being here today with my gynecologist hat on is really exciting because I've been an obstetrician gynecologist for 25 years now, and being able to use that experience and skill set in something as important as period poverty is a real privilege. Many of you on the call will know me. I also am a Global Women member, and so really nice for me to be able to marry up what I do at work, what I do in my business time, what I do in my personal time, with being able to be part of this webinar. I work 2 days a week at Minimal Hospital, and so I'm working in one of our most underprivileged geographical areas, and so I have quite a lot of insights into how women in South Auckland have to struggle every day for all sorts of parts of their lives, but obviously period poverty is what we're here to talk about today. So great to be part of this kōrero. Thank you for the invitation.
Yeah, well, we're excited to have both of you. And sadly, we were going to have a third panelist, Michelle Wilson. Sorry. Unfortunately, she's sick, but I think the conversation will be great with Emma and Caro. So that's great. So shall we crack into it? Yeah. So the first question we have for both of you is around period inequity in general. So we know that each of you have a unique understanding of how periods can create inequity. Could you please touch on how you have seen inequity be linked to periods, and what have the consequences been?
Kia ora. So I've worked in schools for the last 30 years, in secondary schools for the last close to 20, and obviously there's an impact on young women's ability to attend school. It's been a really noticeable pattern that for some of our students that they miss 3 to 5 days of school, sometimes every month. And that's simply around issues around their menstruation. Either they don't have the products, or they suffer really significant symptoms through their period, which get in the way of them actually attending school. And that over years, represents a really significant proportion of their right and access to schooling. It also means I've witnessed young people who have not been able to take part in sporting and co-curricular events because they don't have products, or they actually are being debilitated by really significant menstrual symptoms. And again, that impacts their participation, their sense of connectiveness, their sense of actually being part of an active part of engagement in their communities. And that all obviously has knock-on effects in terms of their well-being, not just their physical well-being, but their social well-being and their spiritual well-being around how they see themselves and their hopes and dreams for their future, as well as their emotional and mental well-being. So it's, far-reaching, really.
Yeah, that's pretty significant on young people's lives.
Yeah, it really is.
Yeah. Emma, do you want to add to that?
Yeah, I think, I've got many of the same themes as Caro, but I guess, as well as the time off school for adult women, it's time off work, which affects the whole family. And so the family income is impacted if she's working. There's also a knock-on effect on often intimate relationships. So if you've got a woman who is having heavy irregular periods, she might be menstruating for 3 out of 4 weeks. That has a significant effect on her relationship with her intimate partner, and can be quite difficult. And you can imagine that is also exacerbated by your ability to access healthcare. So if you have, the funds to be able to pop to your GP and take time off work and go and have a chat to your GP, and then maybe see a specialist and get some help with managing that type of periods, then actually, yes, you can address your being able to go to work. Yes, you can address your being able to have an intimate relationship. But if you're stuck in a situation, you can't actually afford to go to the GP. And then if you do see the GP, you can't afford whichever tablets or medications or treatments it is that they've prescribed, then you're stuck in that same cycle of your periods actually being a very controlling part of your life. And one of the things that we're seeing is that this, I've talked to a lot of my colleagues in Middlemore. I've looked up some research. There's not a lot of research here, but there is an emerging thing that particularly Pacifica women seem to have more debilitating periods. There's a bit of research going on in this area, but there needs to be more. And so again, you're stacking against these women, because as well as not being able to access or afford to access assistance, they actually probably have more problems in terms of periods as well. The other thing I was going to just talk about is that there are new things coming down the line. I kind of didn't know whether to put it here or put it into the good news, because there is a good news question coming at the end, which I thought was awesome. But one of the things that's recently happened is that in the last 18 months, a well-known intrauterine contraceptive device called the Mirena, and I'm sure that many of the participants of this webinar will be familiar with the Mirena. If you talk to gynecologists who are female, I would say 75% of us have a Mirena. So if that's not good advertising, I'm not sure what it is. But it's basically a contraceptive device which releases a very small amount of progesterone. And it was designed for really good contraception. It works really well. But one of the really good benefits is for a large number of women, it actually reduces the blood flow during menstruation, even to the point of maybe not having periods. So for a lot of women, that becomes a really good way of being able to manage heavy periods or irregular periods in a really straightforward way, reducing the cost of requirement for sanitary products. But it's often out of the reach because it has been in the past very expensive. And the only way you've been able to access it is if you've been able to prove that you have a very severe degree of anemia. And when we talk in medicine, we talk about ferritin levels and so on and so forth. So you've had to prove that, but that's recently become actually easily accessible. And that criteria has been removed, which means a lot more women could get access to it. But this also then brings me back to the issue of getting to the GP, getting the appointment, finding a GP who has the skill set to do it. And then also, which we were talking about briefly before we opened up the webinar, is the cultural aspects of, is this something that's acceptable to women? Because your education, everything that happens around you helps to inform you as to what is acceptable. So I might just stop there because that's quite a lot already.
Oh, it was really interesting. So I also have a Mirena, and I got it at university, and it significantly improved the quality of my life. It's so good because you just don't have the mental load of having to think about periods as much. And I couldn't speak higher of it. But the only reason I was able to get it is because I asked my mum to pay for it. So because it was like $300 and something, which was a bit of a it's an awkward conversation to have. But and so it's only because I was in a privileged position that I was able to get it. And I think that's an interesting perspective in terms of how inequity plays into it.
I actually think it's not an awkward conversation. It's a very cool conversation. And if I'm a mum and my daughter can ask me to pay for her Mirena, yay! I've done a good job as a mum of keeping those, channels of communication open. So that's cool. Yeah.
Exactly. And Emma, you did touch on this, and we know from the Youth 19 survey that Māori and Pacifica are disproportionately affected by period poverty. So we've touched on some of the impact, but what's the long-term effects of this, and what more should we be doing? We've talked a lot about the barriers of GPs and costs and things. What more should we be doing?
Yeah, I mean, I think that, we've talked about the barriers because I've got a whole bunch of things. I mean, some of the stories that you hear are just really, really upsetting. Young girls, and Carol will know this as well, and women in families using towels and napkins because they can't afford period products, and they are not leaving the house for days at a time. So they're kept out of society because they can't go out without a product to protect them from their period bleeding. And so you get the absenteeism at school, but then that knocks on further because we know it's a little bit like when we talk about the career pipeline for women, is that each time a woman takes time out to have a baby, she's back. And so when you compare a woman who's 40 with a man who's 40 with the same qualifications and the same time, she will be behind him in terms of where she's at from a financial level. And so you're now not just talking about the pipeline after school where you have babies and then you're back. You're talking about now I can put my hands high enough, you're actually back at the school level where actually, you're not even going to you're going to be behind because you're a girl and because you're having periods and you may be taking a week off a month. And I mean, Caro is better placed to talk about this, but the knock-on effect is going into adulthood and beyond because of the fact that you're missing more school because of your periods. And that difference is going to be exacerbated within our Māori and Pacifica population because it's going to happen to a bigger degree at that level, whereas a well-resourced family, maybe a girl might miss 1 or 2 days a month if she has pain during her period, but she's not likely to miss a whole week because she can't afford a sanitary product.
And do you see research being a way that we can shed light and look at potential solutions in this area?
So as I said, I've made a lot of notes here. And that was exactly one of my points. And as part of preparing for this webinar, I'm so lucky where I work at Minimal. We have an amazing women's health department. We're all passionate. We all work there because we're passionate about the women that we serve in South Auckland. And I have a lovely Pacific Island Niuean colleague who spent quite a bit of time talking to me just about this. And, she's an academic, and we talked about research as being one of the key factors that we need. So we need more information. We need to understand more about what is happening. And I think that this webinar has been great because it's kind of catalyzed some conversations in our department a little bit about, how do we get the information? How do we find out how best to support women in our environment to help them to excel and be the best that they can be? And certainly in terms of research, it's probably around it. I think one of the issues we have in medicine is that we often come in with okay, here's the problem, here's how we fix it. Now, how you fix a problem for me is different to how you might fix a problem for somebody else. And this is how we need to rethink how we do things. And so what our research, we felt when we talked about it as a group at Minimal, is we need to actually understand how best to support and empower women, but also to ensure that the women in our community feel confident that they're getting the right information from in a place that works well for them. Because one of the issues is around the way that information is often presented is a one-size-fits-all.
Yeah.
That actually for a young Pacifica woman as opposed to an older European woman, it's very different. I've got a 18-year-old daughter, and so the way that she texts me, I have to go and check it out sometimes on on the internet. What does that mean? Okay, I think I understand. IRL, okay, in real life. Okay, I'll see you later, IRL. But that's just the sort of a silly example of how, the way that you communicate can be so different. And you think you know what you're talking about, don't. So when we talked about research and we sat down together and brainstormed, what could we do to help women? Then understanding how best to have those conversations, how best to make sure women access the information was one of the things that came out top on our research list.
Definitely. And Kara, what do you think we should be doing to help reduce the inequity in this space?
Yeah, well, it's a real issue, as sadly as research shows us, that particularly for our Māori and Pacifica young woman, and often, I can think of times when we've had 3 siblings all away from school at the same time. Because of menstrual issues, because we know that often menstruation sinks and women in a home will end up with similar cycles. And I can think of a few years ago where we had 3 siblings away constantly, and that's just horrific. And we know that period products are really they are not inexpensive, and when you have a home with more than one female, that's a significant proportion of money and resources that needs to be spent. And we know that a significant number of our population, particularly our Māori and Pacifica population, are living below the poverty line. So they're constantly having to make decisions about where they spend their resources, and getting medical care, getting sanitary products, it's the lowest down the list, you know. So, and it affects long term. It affects. For me, the biggest impact I see is in terms of developing identities around young women. You know, adolescence is a critical time of development in terms of working out who we are, what's important to us, and how we want to be in the world, and how we want our place in the world. And the sense of shame, I think, and embarrassment, and of not being good enough that comes with as a result of having to use toilet paper or whatever else you can find to try and manage your menstruation, it's you know, that's at a very deep level that impacts. And what do we want to do about it? I think the biggest thing we can do is, as Emma said, is about education. It's about having the courage, all of us, from wherever we come from, keep having conversations, courageous conversations, and engaging our young people and engaging our colleagues and our peers, and trying supporting. For me, it's about trying to support young people to have a voice, to find their voice, because if you're prepared to listen, our rangatahi are really amazing, resilient problem solvers, and they will often come up with solutions and ideas that we haven't thought of. So I think that's creating a space for them to have a voice, really listening, giving them opportunities to take actions, really important. As Emma said, research and education is absolutely key. And as I say, we had a beautiful young doctor come and join us 2 weeks ago, and she was a student that I taught, you know, more than a decade ago, and she's now a GP, and it was really lovely to bring her into our space as a young Māori practitioner to talk to our students about periods and about contraception and about all of that stuff, and for our students to see a young woman who was passionate was really powerful. So I think the more we can make opportunities for our young people to hear from other young people from a culturally relevant and inclusive place is really powerful. And as a Pākehā woman, that's one of the things I can do, is try and help build those networks.
And I think, just sorry to jump in, because that's fantastic, Cara, I totally agree, and just sparked in me a conversation about something we talked about before we started, which was there are some amazing initiatives. If you think what's happened with climate change and Greta Thunberg, these young people have mobilized and done an amazing job there. And I think the same thing could happen here. And you talked about having that wonderful young doctor come and talk to your students. So two of the things I'm aware of, one is the Auckland District Health Board have this peer sexual support program, which is students from high schools who are identified generally by the school counsellor, and they have to apply for it, and they go through a program of application, and they become the support within the school, the peer sexual support, which is all run and supervised by the school counsellor. And as part of that program, they have once a year a retreat, which Auckland District Health Board run, and they're from schools all across Auckland. And my daughter was at Selwyn, and she was lucky enough, Selwyn College, lucky enough to be part of that program. And it's been amazing because they do all these things, like they'll have a day where they talk about gender diversity. They'll have a day where they're handing out free condoms at school, and they're known as the kids who've gone through a bit of training, and they know how to access things that the children that come to them need. And so, for example, someone comes and they're feeling a bit down, they don't know who to talk to, they'll go to one of these kids and they'll say, right, okay, you need to go see this person. They'll get the right person for them to talk to. But it's an easier step than waiting till they're so depressed and so down that they don't know what to do with themselves. They've got something, you know, that is an interim. The other thing is that we've been lucky enough at Organic Initiative to team up with the Girl Guides. And so Girl Guides are now working closely with us around some education. And so that's another group of young women who are now going to be, you know, hearing more about periods, talking about them in a setting which is you know, is one which feels safe and similar age. And so I think there's lots of ways we can help our young women to lead this and support them as they lead it, just as you're saying, Caro.
I think New Zealand's been on a journey with this, and now we actually can have these conversations, which I think is really important. And it's a shame Michelle's not here, because she's been such a leader in the space to bring a Te Ao Māori perspective of periods to light. And so I really, you know, admire the work that she's done, and I'd encourage all of you to look up Aotearoa and see their kaupapa and in terms of embracing the Te Ao Māori perspective, because periods have become part of the colonisation process and have quite a Western lens applied to them. And I think social media has also increased the visibility for young people to be able to seek information and different perspectives, and also a choice of product as well, and have a conversation that, you know, they might not feel comfortable having in person, but they've got that ability online to have that normalized to them.
Yeah, I think she wrote a really beautiful article, I think a year and a half ago on the spin-off, talking about the Te Ao Māori perspective of periods and how there wasn't always the stigma associated with periods, and how that's developed over, you know, since colonisation, as you touched on, which leads quite interestingly into our next question, which is around, well, through our experience with Dignity, we have seen significant amounts of shame and stigma associated with having a period and having to talk about it. And we did just touch on this a little bit, but it'd be interesting to know what effect you think stigma has had on periods, and what we can do to try and tackle the destigmatization further.
It's all about having conversations whenever you can. And I think I get very heartened. I've got a 17-year-old and a 21-year-old daughters. And I feel so heartened by the conversations that I hear them having with their peers and their friends, male and female and you know, non-binary and everything in between. They talk about periods and sexuality and sexual health and relationships all of the time, and pornography and all of that. And I think they're in a far greater space to be able to do that than I certainly ever was. You didn't talk about something you hid away. So I think the more conversations we can have, the better. And I think schools have a really important role in that. And I think, you know, there's a question about that later, but I think schools have to really step up. And I think so do our support agencies in our communities. They have to be brave enough to step in to create those conversations too, because shame and stigma impacts the very core of who we are. It's how we see ourselves, and how we see ourselves totally shapes how we not only see ourselves, but our place in our world, and what hopes and dreams we might have for ourselves and those around us. So it's not even just an individualistic thing. It's, you know, when you've got a whole family who generationally have just struggled with poverty, that impacts everything. And, you know, the biggest thing we need to do in this country, as everybody is saying, well, not everybody, but any of us who know what we're doing, is about giving a living wage. You know, that we've got to address poverty at a really systemic level, and any conversations and cage rattling we can do around that will have a good impact too.
Yeah, that's a really good point.
And Emma, do you have any thoughts on shame and stigma of periods?
Yeah, look, I think, you know, that it is something that our generation, it was something we didn't talk about very much. I mean, I was very lucky. I grew up in a very open household, and my mum was very open about all these things, but lots of my friends were. And I know a bit like Karis, you know, bringing up two daughters and being a gynaecologist, I was determined to have all those conversations really out there in the open. You know, I was always very proud of my eldest. She was at school, I think she was 13, and they had their sexual health program coming up at school, and they had a pre-test, and she got 100% on the pre-test. I was like, yes. And then asked the teacher if she could miss it out the program, and she said, no, I don't think so, you still have to do it. But I do think, you know, trying to be, and it is embarrassing stuff for a lot of parents, but I think, you know, that we just need to make it a normal thing that you talk about all the time. And so, you know, my kids have got very used to it, and all their friends have, and if any of the friends have any problems about any sexual health or anything, they always come to my house and then have the conversation. But for me, it's really normal conversations. I'm doing it at work a lot of the time. So I agree with Cara. It's conversations. It's being really open, and that takes away the shame of it. You know, is by it's just a normal thing. You know, it's a normal thing, not a thing to be ashamed about. I think education is key, and I did notice on the participant, Robin Fawcett is there, so shout out to Robin, who has an amazing program, Nest, which does a lot of education for girls. So you can check out what Robin's doing. I'm sure she'd happy to share it. But I think that, you know, there are some great people doing great stuff out there, but I think that in the schools, a lot of times it's left to certain teachers, and they're kind of like, oh, I've got to. You know, it can be pretty intense for teachers to have to do this, and some of them, I guess, are really great at it, and some not so much. And I think one of the things which I found with my girls growing up, just as a parent, was that yes, it's important to talk about periods, it's important to talk about sex education, but there's also a big piece about relationships and consent, and some of that is quite hard to do at school, I think, and it is also maybe not so well covered, and I think that comes into it as well. So when we think about shame and stigma, all of this stuff kind of goes together. Periods, menstruation is something you talk about. I talked right at the beginning about intimate partner relationships. If you're bleeding all the time, because, you know, in some generations and some populations, you don't ever want to talk about sex and someone's having a period. It's all just too terrible and too embarrassing. But I think a lot of this stuff all rolls in together, and so relationships, how we talk to each other as you know, partners, is a very important part of understanding where this shame comes from.
Definitely. And I think to bring it back to one part around the education, some members might not be aware, but there was a positive periods campaign last year, and that was a collaborative campaign with the industry. So Dignity partnered with about 30 different organisations. So there was Aotearoa, Nest Consulting and the likes, to bring a campaign to the government to provide free period products to students, as well as improve the menstrual education. So there was a discussion paper there. There was a working group which had Robin from Nest on it, myself, Ollie from WA Collective, Samantha Paul, who's now a counsellor from BUSA. Shannon Ray was helping with the digital, as well as Sarah and Danny from the Period Place. And also alongside that was a petition, and that got presented to the Minister for Women last year in November, Julianne Genter, and there was a breakfast with the Women's Cross-Party Caucus at Parliament. And you might have seen in June this year that the Prime Minister announced free period products will be available from term 1 for schools to opt in. So if you are on a board of trustees, please bring this up as a topic, and understand that all students need access to products. So do bring this up. So that's amazing that the government's going through that process to actually have period products be available, just like UK, Wales and Scotland, because it can't just be us doing it. And there was a lot of scattergun approach to everything. But the piece that's missing is around education. There was no commitment towards that. So Cara, it would be really interesting from your first-hand perspective to understand, you know, what is the current educational support that students get around this? Is this up to scratch, and, you know, what needs to be done to improve this?
Well, sadly, I think it's very variable. Hero put out 2017, they put out a report around, after review, specifically looking at the quality of health education in New Zealand. And I think the biggest thing they found was that it is very, very variable and inconsistent. And I think that's really sad, because it means whole populations of young people get either no or limited access to health education or not necessarily great. You know, there's 20% or I think it was 33% was good or above, but that's not good enough, quite frankly. And there's lots and lots of reasons for that. One is that health education is considered a low priority. And sometimes schools will kind of go, oh, well, we can cover the kind of developmental physical health bit in science, and or RE or religious education perhaps can cover that bit over there about relationships and consent maybe, and maybe someone, and I'm really passionate about health education and have been for decades, and I think it needs to be its own content and subject in its own right, and it needs to start from kindergarten, and it needs to be given valuable curriculum time. I'm really passionate about that, but that's not happening in lots of schools. I also think that teacher confidence has a really big impact on schools' ability to deliver really robust, empowering health education, and that depends again on the teacher themselves and the access that they've had to good professional development and the networks that they have developed. And also I think, again, finding ways to work in ways that are culturally inclusive, depending on who the school population is, because one size definitely does not fit all. And until we can actually find some ways to do that, I think sadly it's going to be a bit hit and miss, even though it's embedded in our New Zealand curriculum. I think it's still really variable. There's lots of good practice out there, and I can certainly talk about what good practice is, but I think that's not what everybody's getting right now.
No, definitely. It's interesting, right? Because you want to be flexible enough to allow for information to go in a way that will be relevant to different people, but then it needs to be consistent and thorough. And like one of my friends, she went to a Catholic high school, 8 years ago, and she got taught barely anything. And it's really interesting that in New Zealand that can still happen sometimes. And I found that quite shocking, because I thought it was more thorough than that, but it wasn't. But
really inconsistent.
It's really inconsistent, and I was really shocked by that. But another area that is also really interesting that I wanted to delve a bit more into is around the gynecological health issues that women face, and how this links to the exacerbation of gender inequality too. So Emma, would you be able to touch on how the underfunding of gendered health issues, including period inequity, but also related to other things such as endometriosis, vaginismus, chronic pelvic pain, affects women and contributes to inequality further? Yes, and what should we do about it?
I've got lots to talk about here. So for those that don't know, vaginismus is a form of pain which comes through sexual intercourse, so it has an enormous impact on intimate relationships. And I just thought it was a good starting point to say, well, the treatment is very much to see gynecologists, and often it requires a lot of support in terms of psychological support, a sex therapist, counselling, and it's really important. And so, unfortunately, mostly that is not well supported in our public health sector. Compare and contrast the over-the-counter ability to buy Viagra so that a man in his 70s can still be sexually active. I guess I'm being a little bit, I don't know. I'm just pricking you a little bit with that, and just saying, look, that's just a sort of slightly lighthearted way, but actually it's incredibly important. And so that's one part of women's health which is not well supported in terms of funding and what's available. And so it leads me on to many other areas. So endometriosis, for example, and chronic pelvic pain. These are conditions which have both for a long time considered, you know, a little bit fringe, maybe not a real thing. And it really took in the sort of 80s when we were able to actually do a lot more investigation of these conditions and really take biopsies and look under a microscope and say, yeah, that's a real thing. That really is a real thing. And that woman is suffering, and we now know what it is. And so we'll give it a name, and now we start looking for a treatment, and we struggle for years to find a treatment, and then, oh gosh, okay, well, it's all a bit complicated. And so because a little bit like we were talking about one size fits all for education, endometriosis and chronic pelvic pain are classic examples of one size fits all doesn't work. And so when you want to look at treatment modalities, they're complex, they're difficult, there's lots of different elements, but they are not life-threatening. And so because they're not life-threatening, they become very, very low on the pecking order of funding. And so I do know that for both of these conditions, currently at Middlemore Hospital, we don't have the ability to manage them. We just don't have the funding. Any theatre space we have is going to cancer, mainly. Any clinic space we have, well, do we want to see someone where we're going to turn around and say, yes, we know what you need to have done, but we can't do it? So it's pretty hard for us out there. We want to help women, but we're really struggling because of the funding issue and the fact that we don't have the funding to be able to do this. If you go to private practice, you can do it. You can get it done in private practice. Some hospitals will be able to afford it. So because we have 23 DHBs, each of which is run by their own CEO and their own board, they all work out their own funding models, and the funding that they get is dependent on their population. It may be leveraged to some degree depending on the type of population they have. But we know that at Middlemore, we really struggle to get the funding that we need for our population. We have a really high needs population. And so we know that if you go to some other hospitals, you may be able to get that treatment. And so you have what has been described as a bit of a postcode lottery for women who have problems such as chronic pelvic pain and endometriosis. And that to me doesn't feel fair. And most of my career in the last 10-15 years has been about trying to provide equity across New Zealand for the area that I work in mainly, which is complex pregnancy. And so we've been able to do that, but it's been extremely hard to do that because of the way that our health system is funded, and very much in those 23 DHBs. So that's those two conditions. I'm sorry, I've got a little bit more to talk about, and I have told you to give me that sign if I need to stop. The other thing, which I think is a very big, hidden, shameful condition, which is not to do with periods, but is to do with women and childbearing, is pelvic floor dysfunction. And so we're talking now about urinary and fecal incontinence, and this does affect men as well, to be fair, it affects men and women. But it is the hidden, shameful condition that so many women suffer from. And it's something that we've seen firsthand at Middlemore. We've seen women who cannot be intimate with their partners for years. They cannot leave the house, and there are treatments, but we haven't got the funding to offer them. And that's really, really sad for my colleagues who work in that area, to be having all the skills, have done all the training, be the surgeons who can fix a lot of these things, but then actually not be able to provide that care. But that's if the women get to us, because a lot of the women don't get to us because of the shame and stigma. And so for them to have actually got to us through the shame, through the stigma, through the GP cost, through the consult, and then to be told, look, I'm really sorry, our waiting list is a year, that's just pretty hard. So I do think that we do, I don't think we prioritize enough these conditions because they're not cancer, and they're not necessarily identified as being a major problem, but for those individual women, they can be an enormous barrier to living a healthy, normal life. And by virtue of that, the family around them, the whānau, is also affected by that woman's struggle with her periods or being able to leave the house because of incontinence. I've got one more thing to say after that, but I'll stop there because it's one more gynecological thing to talk about. Do you want to ask me anything about that? Because it's slightly different.
No, we were just going to go on to
the
any good news.
Okay, well, let me just finish my last thing because it's hot off the press. I've got the paper here. And what it was that gynecological cancer, it's a really important area. There's a whole bunch of wonderful organizations educating us how to look out for it. Hopefully everybody who's the right age is getting their smear done, is getting their mammogram. You know, there's great screening available. But we know that if we look at cancers, ovarian cancer, cervical cancer, uterine cancer is the one that generally gets picked up early and is very easily treated. Sadly, the treatment is usually quite significant. It's a hysterectomy, and it usually affects women after the menopause. And so although it's big to have an operation and have a hysterectomy, it's not, it's not like it's affecting your fertility. It's usually at a time of your life where you've completed your childbearing. But hot off the press, we know that endometrial cancer of the lining of the womb, is much more common in women who are obese. And what we're seeing in our South Auckland Pacifica population of women is a very significant increase in the rates of endometrial cancer and an increase in the death rate from endometrial cancer. And we're seeing in very young women. So we're seeing endometrial cancer in women in their childbearing years. And so you're now looking at women who, because of obesity, the knock-on effect is you lead to a higher risk of endometrial cancer. We detect it, and then the treatment is potential loss of fertility in a younger woman. And so, we've got these emerging themes which we never thought we'd have. It's like diabetes. Young people with eyes that are almost blind in their 30s. We've got these amazing emerging themes coming through health, which we never thought we'd have. And coming back to the endometrial cancer, a lot of these women will have heavy periods, and they'll think it's just heavy periods.
Yeah.
So
no, and really appreciate the work. Really appreciate the work that you do with women at the hospital and pushing for these changes or shedding light as well. Really keen to get to some of your questions, but I think if either of you could just quickly, I know a lot of this is quite heavy and really hard to understand that this is happening in New Zealand right now. Could you give us any hope of what's happening at the moment? Just one or two things, potentially, Kara, if you wanted to start. Good things that are happening.
There's always hope. As long as we've got young people and older people like us who are passionate about it, there will always be hope. I'm a firm believer in that. I think empowering our young people to activate. There was a really strong campaign last year and the year before that came from young people, grassroots, to get sexuality education around consent compulsory in schools, and that's gone through. That needed to happen, and it's happened. We now need to get the government and schools to make sure they value that and get training and resources to actually make that happen. So definitely it's about empowering our young people, and you two are fabulous examples of that. Definitely around that. And I think the fact that already in the last, 5 years, just the shift that I've witnessed in the normalising of conversations around menstruation and sexuality education and sexual health and women's health and even inequity and poverty, I think that's really powerful. So we've just got to keep having those conversations.
Definitely.
I'll keep it super quick. I think this is amazing. I think what you guys do with Dignity and many other organisations is fantastic. I think having Marina funded is brilliant. We just need to organise the access for women and make sure women understand why it might be helpful for them with their periods. And I just found something on period leave work. I don't know if that's a good thing or a bad thing. There's a whole bunch of argument one way or the other.
Cool. So there is some positivity out there, which is good. But now we've got about 10 minutes left.
Yeah, there was two questions in there. If you've got any, please put them into the Q&A at the bottom of your screen. One of them was around the Amazing Group Days for Girls, and so we have spoken with them a bit, and you spoke with them a few times.
So they're an organisation that works with people in developing countries to create reusable pads, and then it's a social enterprise model in itself, so they can create them and sell them so that people in their community not only have access to them, but it's also a source of income that can be subsidised too, which is really, really cool. So what was the key question around that?
I guess if we're working with them, I mean, there's a few groups around New Zealand that do have sewing groups, which is really really cool, and I think they do also distribute with other groups, and we do actively talk to them, but we do have a lot of products that we do give out in terms of having the choice already with the organic pads, tampons, menstrual cups, and period underwear. But I think what's amazing has been this increase in understanding of the different products, and also having that ability to have choice with all those products as well. And so there was one question there, Caro, in terms of how do the students access products? Do you think they should be freely available? How that works in practice.
I think, well, it's going to be really interesting to see how the rollout works. I know it's being trialled in Hamilton currently, and we're well supported, thankfully, through Dignity here at Hiwarahi Tamariki, and it makes a really big difference because all of our young parents here are benefit dependent, so having access to free period products just makes a huge difference to them. I think schools, again, mobilise your young people. You can do it. You can even get credits for it through some social studies and some papers around actually taking social change and social justice. We've had students who, before we were engaged with Dignity, actually running drives to get collection of sanitary products and making sure they were available in bathrooms and in whānau rooms and rooms. There's absolutely things that you can do. But I think Board of Trustees and health educators in school and counsellors in schools absolutely need to prioritise health education. I feel really passionate about that, and actually making sure they follow up on how to access this rollout for free sanitary products. We haven't as yet had any information around it, but that we need to keep following that up.
That's cool.
Yeah.
We had another interesting question come through talking about how do we better involve dads to talk about periods and issues like these. Do either of you have a view on that?
I think we, as women, need to be brave and have conversation with the men around us, whether we are involved in intimate partnerships or not. We need to be, again, normalising those conversations around menstruation and women's health and inequality and all of those things. And as we do that, then I think our men will develop more comfort, perhaps, and confidence to be able to engage in those conversations. And again, schools, I think these conversations need to be happening at primary school. Destigmatise, so that we're all familiar with the language, we all use the same language, and it's just a thing. It's just, we talk about going to the dentist or going to the hairdresser or whatever. Actually, let's just normalise it.
And I was talking to a friend recently with an 8-year-old, and she was saying to me, well, when should I talk about periods? I said, well, you should have already talked about it. Like it's something you just talk about. They say, what's that box in the cupboard? Well, it's dad. And I said, and actually the other thing is, for a lot of our girls, the age of menarche, the first period is getting younger and younger. And actually primary school, some girls will be having their first periods in primary school. And so you can't necessarily, it has to be young, just an understanding so that they know that if this happens, they know who to go to and what to do and not to panic,
Would agree, and I think a massive shout out to Dr. Sarah Donovan, who has done so much work and research in this space, and she had that piece of research come out that students as young as 8 were getting their periods, and that's feeding into some of the advocacy work that there's not the sanitary bins and the bathrooms in those schools. So it's so important, as we've talked about, that information and having that play such a key part towards actually creating change. So that there hasn't been that much information on periods, and that's what we found when we started in 2016, and why we purposefully put in impact reporting for us to talk with the schools and the community groups that we serve to understand what's actually happening, and that fed into the government change as well, that 72% of schools said students weren't able to come because there wasn't that access to products, and that it reduced the feelings of shame and stigma and the ability to partake in sports. So data and information can create change and shed light on things that we didn't know about. So where there's potentially not enough time, there was one really long question in there which was quite good, but I really want to give that the time to actually provide a response. So if you could email that through to Global Women or to us at Dignity, that would be really good, and we'll be able to respond to that one.
But this has been a really, really interesting session. We had to miss over a bunch of questions, which was really really interesting, but there were so many more topics I wanted to delve into. So I'm really glad we had this conversation, and we just got a question through saying, will this be available recorded? And we are recording it, so you will be able to view it later. But thank you, Emma and Caro, for chatting to us today and giving up your time and sharing your insights, because I learned heaps actually. There was so much stuff in there I didn't know, so I'm going to rewatch it to educate myself and rewatch it and make notes. So basically, as we touched on at the start, we work to provide period products to people without access, and we're currently we have a lot of demand for product that we are not able to currently meet. And so if you want to be able to help us, there's two things that you can do. The first thing, which is the most, would be really amazing, is if you could introduce us or connect us in with organisations that might want to work with us, to partner with us to provide period products either at their workplace or also donating to our impact partners. And if you can't do that, the second thing is we also have our donation model. So if you want to flick us a donation too, that would be great as well.
Our gifting, and thank you to everyone who's come along to this courageous conversation. As Caro put it, I think the more and more we talk about this, the more and more that change can actually happen. So really, tautoko your work, Caro, on the front line with students, and your advocacy that you've had for decades, actually doing something, and also with you, Emma, absolutely amazing, your work with women, and that you're touching women's lives every single day and empowering them in a really tangible sense.
Well, let's hope that there's more to come. Let's do some more in this space, absolutely, and let us know what we can do to keep supporting.
And thank you for the opportunity.
Thank you very much.
Letting me ramble on a bit.
No worries, and a big thank you to Global Women for being such amazing partners, for bringing this webinar along. Really, really appreciative of you partnering with us to do this. So have a great rest of your day, and if you want to find out more about Dignity, we're dignityNZ.com, and thank you so much for all of your time.
Thank you.
Ka kite.